Your opinion matters, so let your voice be heard. Let's talk about nursing. Right here. Rapid Response with John. Oh, it's covering my mic, my video. Anyway, hi guys, how are you? It's good morning time. I know, my God, anong oras na? Gising pa ako. Actually, it's 2 o'clock in the morning here, my time zone. Would you believe that? 2:00 ng madaling araw and I am fully awake. What happened to my time clock? What happened to my sleep pattern? Anyway, katatapos na ng klase ko sa kabilang batch. Katatapos ng klase ko sa isang review program and then I still cannot sleep. So sabi ko, might as well mag-stream ako kahit na ganitong oras, kahit na walang manonood. Anyway, definitely you'll be able to watch this once you're awake, fully awake. I know it's afternoon time in the Philippines. Probably ano ngayon sa Pilipinas, May 15 ng 3:00 ng hapon. Diba? Today is actually May 14 to 12 in the morning and it's Mother's Day. O, diba? O, sa mga mothers natin dyan, maraming salamat po sa lahat ng mga pag-aalaga, sa lahat ng mga sermon, right? Lahat ng mga paalala, maraming salamat. So that is why, guys, if your mom is still alive, if your mom is still there, give this day to them. Diba? So anong ibig sabihin ng give this day? Treat them, cook for them, just give them a break for one day lang. Bukas, balik na sa trabaho nila. O magluto ka na bukas ngayong araw ako magluluto. Ano ang mga yon? Day off. Grabe sa 365 days. Diba? One day lang yung off nila ngayong araw lang. Anyway, so if you were very keen, I posted something the other day and I made a promise to myself. Sabi ko talaga, ay nako, kailangan ko talagang gampanan to kasi sabi ko ang daming dyan nagre-request. Sabi ko, oo na nga, sige na. So, ang gagawin ko is that I made a promise to myself na every week, mag-stream ako and I will discuss a specific topic every week. Dapat talaga religious ako every week. Kasi minsan kasi nangyayari, depende sa mood. Diba? Depende sa mood. Depende rin sa availability. But definitely, promise ko talaga, magla-live ako every week. Siguro mga every Sunday. Kasi Sunday dito ngayon eh. So, gawin ko na lang every Sunday yung aking stream. O, diba? Talagang talagang ginumpanan talaga every Sunday. Anyway, so yun nga if you happen to check my post a few days ago, I said that I will have my stream and we will talk about immune defenses. Na minsan hindi siya dinidiscuss sa review. So we will talk about immune defenses and the next Sunday I will talk about physiologic changes during pregnancy. Okay, and then a week after that, we will talk about ABG ba yun or diabetes mellitus. So that will be 4 consecutive Sundays. Okay? So yun po guys. So anyway, may nanonood ba ngayon itong oras? Para akong baliw. Anyway, who do we have here? Yay, may nanonood. Hello to Levi, Kaylen, Agpad. Grabe, anong oras din sa'yo? Nanonood ka pa. Magtrabaho ka muna. If you're working right now, you do your job. Baka mapagalitan ka ng supervisor mo. Okay? Aray nito, magising pa. Anong ginagawa nyo dyan sa buhay nyo? If you're working sa hospital ngayon, 3:00 ngayon sa Pilipinas, 3:00 ng hapon. Ingat po kayo. Chris, ang balita ko ang init sa Pilipinas ngayon. So don't forget to hydrate yourself. Okay? And hello to Crisia Pascual. Hi there, kumusta ka? Miss Pascual. Naalala ko dati may CA ako dati. Ay, Pascua pala yun. Hindi pa Pascua, si Ma'am Pascua. She's a good clinical instructor. And she's here in the US but I haven't seen her. So anyway, if you happen to know her, Ma'am Pascua, si Ma'am Cookie, she's one of the best clinical instructors I ever had. Anyway, so yun nga, sa gaya ng sinabi ko, we'll talk about immune defenses. Okay, so we'll talk about how immune defense works. Okay, and what are components of the different immune defenses and what are the different types of immune defenses? Okay, pag-uusapan natin yon. And then of course, ano mga possible questions sa NCLEX examination? Kung hindi man sa NCLEX examination or possible questions in your qualifying exam that may come out when you talk about immune defenses. Okay? So yun ang gagawin natin ngayong araw. Ngayong araw talaga, buong araw. Hindi, ano lang to, mga 30 minutes lang or 1 hour. Depende kung aantokin na ako, tigil na natin. Diba? Anyway, kumusta kayo guys? Kumusta ka? Ano ginagawa mo dyan? Meron pa tayo. Aba, may mga nagka-heart-heart. Alam mo, iniisip ko talagang walang manonood. Kaya sabi ko, madaling araw. At meron talaga. Anyway, so we'll talk about immune defenses. What is the relevance of this? And then, ano yung mga dapat tandaan for your qualifying exam? Okay? Okay, let me share my screen, guys. And then after that, we'll start discussing immune defenses. Give me a bit. Okay, what do we have here? Oh, okay. Okay, so let's talk about immune defenses. Prior to that, tandaan natin that this is actually part of your immunology concept. Okay, if you're familiar with this, your immunology is actually a concept that will talk about how the body defends itself, how the immune system protects the body. Okay, so this is actually part of your immune system. Okay, so we have here your, bakit ayaw gumalaw nito? What happened? Oh, sorry. Hey, my pen isn't working. Hold on. Hold on, guys. Okay. Sorry, guys. Oh, there. I just hope it will work this time. Please, come on, work. Good. Okay, so let's talk about immune system. Okay, so when you say immune system, it's actually a complex network of cells, tissues, organs, and the substances they produce in order to protect the body from infections or other diseases. Okay, so if you define what immune system is all about, this is actually a complex, okay, a complex network of cells, okay, tissues, organs, and substances. They produce to protect, or shall I say, to defend the body from infections and other diseases. So can you imagine this? This is the only defense that we have, okay, to stay alive. Okay? So technically, yung trabaho niya talaga is to what? Is to protect you from whatever assault that is happening, from whatever assault that you will encounter in a day-to-day basis. So if your immune system isn't intact, okay, can you imagine that if your immune system is not working well, Okay, if your immune system is not functioning well, what will happen? Nobody will protect you from assaults. Nobody will protect you from infections or other diseases. So you will end up having what? You will end up harboring all those infections. So you will end up having what? Sepsis. Okay, so that is why that is so important for you to take good care of your immune system, because failure to do that, okay, depressed immune system, what will happen is magkakaroon ka ng infection. So you will be labeled as an immunocompromised person. Anyway, meron dito nagpapabati. Nurse IC, hi sir, night shift pa po from Philippines. Hi Nurse IC, thanks for watching. Ako nga ay madaling araw dito. Alas 2 ng madaling, actually 2:21 in the morning. Madaling araw na, hindi pa ako makatulog. So I decided to go live. So let's go back. So yun nga, no, pag sinabi kong immune system, it's a network, complex network of cells, tissues, organs, and the substances they produce. Eh meron palang ganun, yes, because there are lymphatic or not lymphatic, there are immune structures that will produce a specific substance that will protect you. Okay, so ibig sabihin, if you are an immunocompromised individual, immunocompromised patient, the main concern here is you harbor or you get infected. That is why importanteng alagaan natin yung immune system. Okay? So later on, we will talk about paano ba palakasin natin yung immune system natin, yung resistensya natin. Okay? And then what are the different structures, okay, under immune system? Kasi nga sabi mo, surgeon, is a network, complex network of cells, tissues, organs. So ano yung mga structures under immune system? Okay? So these are the different structures under your immune system. I think I have a picture here. This. Okay, here. Oh, sorry, I forgot to share my screen. Here. So these are the different or common structures or organs under your immune system. So you have your lymph nodes, okay, you have your appendix, okay. Sabi nga nila, sir, meron palang function yung appendix? Meron po. Okay, kaya lang its contribution towards immunity is very, very low. That even if you remove the appendix, okay, even if you remove the appendix, it will not impair, okay, it won't impair totally your immune function. The contribution is relatively low. Okay, bone marrow is also part of the immune system. Why? Because the bone marrow will produce lymphocytes. The bone marrow will produce leukocytes, and we will discuss that in a bit. Your tonsils and adenoids are also essential here in the throat. That is why if you notice, if you have frequent sore throat, okay, if you have pulmonary infections, pwede ka magkaroon tinatawag nating lymph node enlargement sa neck, or because of sore throat, pwedeng mamamaga yung mga tonsils at saka adenoids natin. And by the way, for mga pediatrics, pag namamaga yung adenoids nila, there is always a risk of airway obstruction. Okay, as well as your thymus. Where is your thymus situated? Your thymus is situated at the back of the sternum, fronting the heart. Do you know that when you were still young, okay, kung bata ka pa, malaki yung thymus natin. And then, when you grow old, the thymus decreases its size. Normal ba yun? Normal yun. Okay, so tandaan na, when you were young, your thymus is big, but when you grow old, okay, when you age, the thymus size will also decrease. Okay, and take note, thymus plays a vital role for immunity. That is why isa sa mga management ng mga na ginagawa ng mga doktor sa mga pasyente po natin na may autoimmune, okay, is to remove the thymus of the patient. And we call the procedure as your thymectomy. That's removal of the thymus. Okay? And you're also, okay, another structure involving your immune system is your spleen. Alam naman natin that spleen is on the left upper quadrant of the tummy, of the abdominal area. So your spleen will also play a vital role for immunity, as well as what do you call this, parang yung mga old na blood components natin, ang gagawin niya is ibabalik niya sa katawan para magamit ulit. Okay, and just a heads up, a patient or a person who had vehicular accident, one common organ that will rupture during vehicular accident is the spleen. So do not forget this one. Okay, that is why if a patient, or if you have a patient who complains and discomfort or any pain or tenderness on the left upper quadrant, Okay, left upper quadrant, you suspect spleen injury. But for patient who complains discomfort or pain in the right upper quadrant, so most probably yung problema ng pasyente could be liver, okay, could be gallbladder. Okay, and of course, another structure involved in your immune system is your payer patches. Your payer patches, makikita yan sa lining ng ating intestine. Okay, intestine. So they will protect us sa mga nakakain nating pagkain, okay, na hindi makapasok, ma-infect yung ating katawan. So para they work as a barrier, okay, to protect you. Okay, so these are common structures under your immune system. And I just want to emphasize some things here. Let's begin with the bone marrow, and then I will also include the lymph nodes. Okay? And if you have any questions, please drop a message and we'll try to answer that. Okay. So we'll talk about the bone marrow. I am referring to your red bone marrow, okay? Remember there are two common types of marrows, the yellow marrow and the red bone marrow. The yellow marrow is where adipose, okay, for fat deposition. The red bone marrow plays a vital role for blood formation, okay? Now, inside the red bone marrow, there is a cell, okay? There's a cell. We call this cell as your pluripotent stem cell. Now, why do we call it pluripotent? Ano ba yung ibig sabihin ng pluripotent, Sir John? A pluripotent means to say that from a single cell, it will divide into different types of cells. We call that pluripotent. This pluripotent stem cell will divide into two, okay? Two cells. First is what we call the myeloid cell. And the other one is your lymphoid cell. The myeloid stem cell will divide into three major cells. Okay, ano yun, Sir John? We have the RBC, okay? We have the WBC, and we also have your platelets. We know that the RBC, these are what we call erythrocytes, responsible in carrying gases, both oxygen and carbon dioxide. Your WBC, these are what we call the leukocytes, okay? This is actually part of your defense. Ibig sabihin, the WBCs are soldiers in the body that will protect you of whatever pathogen, whatever microorganism enters the body. Okay, so they will fight it off. So marami tayong klase mga WBCs or your leukocytes. We have your neutrophils, we have your basophils, we have your, ano pa ba? Basophils, yun nga, neutrophils. So common na mga dapat tandaan when you say neutrophils, neutrophils are cells responsible in protecting you against bacterial infection. Your basophils, okay, are common yung basophils na activate or will protect you during allergic reaction. Your eosinophils naman, on the other hand, common sila na lumalabas during helminthic or parasitic infestation. Kaya pag tumataas yung eosinophil count natin sa dugo, doctors will suspect parasitic or helminthic infestation. Okay? Your platelet, we call this your thrombocytes. This is actually a cell that will protect you against blood loss. Okay? That's your platelet. Okay? What about your lymphoid? Your lymphoid will produce two cells. Okay, we have the B cell or the B lymphocytes and the T cells or your T lymphocytes. Now, I need to stress more on this because malaking importance nito sa ating defense. The B lymphocytes, or the B cells will produce plasma cells. Okay, and plasma cells now will produce antibodies. Okay, what is another name for antibodies? We also call this as your immunoglobulins. Okay, now if you can still remember your immunology concept, there are actually 5 immunoglobulins. Can you still recall this? So you have your gamed. These are your antibodies or your immunoglobulins. Don't forget your antibodies, immunoglobulins are produced by plasma cells. Okay, from your B lymphocytes or your B cells. Okay, wag kalimutan yan na. Immunoglobulin G, don't forget this in NCLEX, okay? Your immunoglobulin G is the most abundant immunoglobulin. And guess what? This is the only immunoglobulin that can pass the placenta. And another thing, don't forget this in your NCLEX. If doctors suspect autoimmune problem, just like your demyelination, okay? Example ng mga demyelination natin, you have your Guillain-Barré syndrome, you have your multiple sclerosis. One test that doctors will order if they suspect multiple sclerosis, Guillain-Barré syndrome, is electrophoresis of the CSF. And they will check the CSF for presence of antibodies. And mostly, kaysa mga pasyente may demyelination, mataas yung immunoglobulin G in the CSF of your patient. So this plays a vital role for demyelination. So surgeon, what is demyelination? Demyelination is a medical term that describes destruction of the myelin sheath. Remember, a myelin sheath is part of the neuron, part of the nerve that plays a vital role for impulse transmission. Ibig sabihin, pag nasira yung myelin, it will affect impulse transmission, okay? He called that problem as demyelinative disorder. Example na sinabi ko kanina, Guillain-Barré syndrome, and then your multiple sclerosis. So a patient with GBS, a patient with multiple sclerosis, when doctors order for electrophoresis of the CSF, they will see an elevated immunoglobulin G. So the precursor for your demyelination is your immunoglobulin G. So ibig sabihin pala, kahit na yung immune system natin will protect us, pag malfunction yon, instead of protecting the body, the immune system can also destroy your own body structure. So we now call that your autoimmune. Instead of protecting you, the immune system destroys your own body structure. One good example there is it's an endocrine problem called Hashimoto's disease. A Hashimoto's disease is an autoimmune wherein sinisira ng immune system ang sariling thyroid gland. Okay, that is why if you can remember, your Hashimoto's disease is an autoimmune problem greatly associated with a condition called hypothyroidism. This is the opposite of your hyperthyroidism. Example, is your Graves' disease. Okay? So in Hashimoto's disease, the sinisira ng immune system ang sariling thyroid gland, resulting to a decrease in the levels of your T3, T4. Okay, see? Instead of protecting you because of a malfunction of your immune system, the immune system attacks your own body structure. Okay? Next, another immunoglobulin or antibody is your immunoglobulin A. Your immunoglobulin A is present where, example, there is in the body fluid, just like your breast milk. Oh, diba? The breast milk, remember the first breast milk na lumalabas sa mga pregnant, remember, it is rich in colostrum. Okay, your colostrum is rich in immunoglobulin A. And what type of immunity is that? When the mom transfers or when the mom gives her immunoglobulin to the baby. You call that type of immunity as your passive immunity. What specific type of passive immunity? Is it artificial or natural? That is a natural passive immunity. We'll discuss that in a bit. And what about immunoglobulin M? Immunoglobulin M is common during bacterial infection. Immunoglobulin E is common during hypersensitivity reaction. Okay, and D, unclear effect. Okay, so these are your different antibodies or immunoglobulins. Now, what about your T lymphocytes? The T lymphocytes, okay, produce here, hindi pa siya ganun ka-specific. So, technically, parang matawag na siya, parang wala siyang kwentang T lymphocytes. Magiging useful lang siya, guess what? If the T lymphocyte goes to your what? Goes to your thymus. Oh, ito yung nabanggit ko kanina, the thymus. Remember, the T lymphocytes need to go to the thymus because there in the thymus, the T lymphocytes will undergo differentiation and proliferation. So it will differentiate, it will proliferate, making the T lymphocytes a more specific role. Okay? So ibig sabihin, when the T lymphocytes goes to your thymus, okay, it will convert into a more specific T lymphocytes. So magiging ano siya? Magiging helper T cell. Okay? Magiging killer cell. Maging suppressor. T cell and magiging memory cell. Okay? And take note, helper T cell, you also call this as your CD4 cell. And guess what? This is the target of your HIV infection. Okay, tandaan na, sa lahat ng mga T cells na yan, pinaka-importanting tandaan yung helper T cell, siya yung unang-unang lumalabas in order for these other cells to come out. Okay? So your helper T cell is so essential. Your killer cell, of course, from the word itself, killer cell, this is a cell that destroys the cell. Okay, destroys the microorganism. Suppressor T cell will suppress other cells not to overdo its activity. The memory cell, on the other hand, is so important as well. Why? This serves as your memory, okay, for future purposes. Ibig sabihin, if you got infected, if you got sick, somebody has to store the specific illness so that if time comes, you will get sick again of the same problem, the same illness, meron ka ng panlaban. Ibig sabihin, maganda siya sa yung mga tinatawag nila sa mga relasyon. Alala niyo, pag sinasabing sa relasyon, sabi nila, ang mga babae daw hindi nakakalimot ng mga mali na mga lalaki. Naniniwala kayo doon? Oh my God! Diba sabi nila, ikaw na babae ka, parati mo lang sinasabi, paulit-ulit yung mga mali ko in the past. Past na yon. Kalimutan na natin, past is past. Siya hindi nakakalimutan. Yan yung memory cell. Ibig sabihin, for example, nagka-infection ka ngayon, so the body will make a memory, will store it in its memory. Hey, I got infected with this specific illness, with this specific infection. At gumaling ka na. And 10 years after, you got infected again of the same illness. So hindi ka na mahihirapan kasi your body developed a specific defense or response to that. So i-retrieve nyo lang sa archive, i-retrieve nyo lang kaysa katawan mo, ay meron akong sakit na ganito dati, so hanapin natin yung gamot doon. So yun yung memory cell. Di ba ang ganda nila? So, ganun po kagaling yung ating katawan. So, God is really good. Can you imagine that? God is really good. He knows where to put things in place. So, anyway, these are the different types of your T cells. So, take note, ito po yung contribution ng bone marrow. Okay, contribution ng bone marrow. So with respect to your defenses, ang nabanggit ko dito na dapat tandaan for defenses, yung WBC, I mentioned that. Remember, I mentioned the different leukocytes. I mentioned neutrophils. I mentioned basophils. I mentioned eosinophils. Okay, and I also mentioned lymphoid. And by the way, speaking of myeloid and lymphoid, if you're familiar with leukemia, there's such thing as acute myelogenous leukemia, acute lymphocytic leukemia. So at least makikita mo yung partition or difference nila. Okay? So again, this is your bone marrow. So another structure that I want to talk about that plays a vital role for immunity will be the lymphatic system. The lymphatic system plays a vital role. And guess what? Lymphatic is also an extension of the circulatory system. Ganun ba yun? Yes. So ang tanong, paano siya naging extension, sir, dyan, ng circulatory? Ganito yon. Now, if you can still remember, sulat ko muna, lymphatic system. So again, di ba sabi ko sa previous ko na stream, when you say system, a system is a composition of different organs. And these different organs, pag nabuo sila, they function as one unit. So ang tawag natin system. Diba? System is a combination of different organs functioning as one. So since it's a system, so ano kaya mga structures or organs under lymphatic system? So you have lymphatic vessel, okay, you have your lymph, and then you have your lymph nodes. Okay? Hindi natin isa-isahin. Ito yung distribution. Ito yung kanyang contribution sa circulatory system and as well as sa immune system. I mentioned that lymphatic system is actually an extension of your circulatory. Paano nangyari yung surgeon? By the way, meron tayo dito. Oh my God, may mga nanonood. Hello to Jaha Abanilla de Chavez. Hi there. Hello to Nurse Paul. Hi, Sir Nurse Paul. How are you? Hello to Jade Juvie. What's this? Toribio. Hello to Doxy Adafiosa. And Ginaline Estrada Gutierrez Cruz. Ang haba ng pangalan mo, ah. Okay, anyway. So ano yung contribution ng lymphatic system? Sabi ko nga, ang contribution niya, something to do with your immune defense, and second is your circulatory. So expound. So remember, part of your circulatory system, ganito yon. Remember your heart? Your heart is divided into two sides, correct? If you can still remember this. Okay, this is the right side of the heart and the left side of the heart. Alam natin that the right side of the heart receives and pumps deoxygenated blood or unoxygenated blood. The left side of the heart receives and pumps oxygenated blood. So when the heart pumps the blood out, the blood enters a closed circuit. You call that closed circuit as your blood vessel. The blood vessel connected on the left side, you call that as your artery. Okay, a small artery is what they call arteriole. Okay, and then on the right side, okay, a blood vessel connected there is your vein. A small vein is what we call venule. Okay, and the junction between artery and vein, you call this as your capillary. Okay, remember, when the heart pumps the blood out, that blood, you're oxygenated, rich in oxygen, enters an artery. That explains that if the blood enters the artery, we know the direction of your blood flow is away from the heart. Correct? So the blood leaves the heart, enters the artery, goes to your arteriole, and passes the capillary bed. Okay? Capillary is a small blood vessel. Because of its characteristic, which is very small, it's very permeable, it's easy for diffusion to take place. Okay? Easy for fluid to shift. Okay? That's your capillary area. So when that blood leaves the capillary, it gets inside the venous circulation. So when the blood enters the vein, the direction of your blood flow here is back to the heart. And the cycle repeats. Now, this is your circulatory system, right? Now, when that fluid enters the capillary, the liquid part of your blood, we call that as your plasma. Am I right? We call that your plasma. Remember, your plasma is a component of your blood. Okay, and outside the blood vessel are your tissues. These are your cells. Okay, these are your cells. Remember that inside the cell, there is a fluid called ICF or intracellular fluid. And outside the cell, there is also another fluid called ECF or extracellular fluid. And guess what, nurses? Your ECF has two compartments. There are two subcompartments of your ECF. The fluid inside the blood vessel is your plasma. And the fluid, mind you, the fluid outside the blood vessel and outside the cell, you call that as your interstitial. Interstitial. So, ibig sabihin, if your lecturer, if your coach will tell you this is an imbalance affecting the ECF, an imbalance affecting the ECF, ibig sabihin, your coach, the one who's talking to you, is referring to plasma and interstitial. Silang dalawa ang compartments ng ECF. Can you follow? So let's go back. It's normal for the body to have fluid shifting. So hindi pala abnormal yun. Normal po na may fluid shifting. Okay? When fluid enters the capillary area because of hydrostatic pressure, okay, it's normal that there are fluid that will leave the vascular compartment. Hindi po siya abnormal. Normal po siya. Now, kung may fluid shifting, bakit wala akong edema formation? Because again, your your vascular compartment, the albumin, okay, is actually normal. Ibig sabihin, kaya niyang i-restore yung nakalabas na fluid. Okay? Magiging abnormal lang siya, magmamanifest ka ng edema pag nagkakaroon ka ng imbalance sa albumin or magkakaroon ka ng excessive fluid shifting or if there is obstruction in the lymphatic vessel. So dito na yun papasok. Okay, now, balikan natin. Sabi mo, Sir John, na normal po na may fluid shifting. Correct. So what do you think is the movement of your fluid here? The movement of fluid will be from plasma to interstitial or intravascular to extravascular. Okay? Minsan, kasama na lumalabas, may lumalabas din na protein. Okay? So ibig sabihin, okay, nakalabas sila. Dito na papasok ngayon ang trabaho ng lymphatic vessel. Okay? So may mga lymphatic vessels tayo dito. Okay? So this is your lymphatic vessel. Yung nakalabas na fluid kanina, okay? The fluid that came out from the vascular compartment will get inside the lymphatic vessel. Papasok sila sa loob ng lymphatic vessel. When that fluid enters the lymphatic vessel, we no longer call that as interstitial. So when it gets inside the lymphatic area, we call that fluid now as your lymph. Okay? So remember, lymphatic vessel is a vessel that contains a fluid called lymph inside. Blood vessel is a vessel that contains a fluid inside called blood. Did you get that? And the liquid part of your blood is your plasma. Correct? So let's go back. So the lymph now enters the inside the lymphatic vessel, and then ang gagawin niya is idadirect niya yung lymph to your lymph node. So andito yung lymph node. The main function of your lymph node is to filter or to clean the lymph. So pag malinis na yung lymph, ibabalik na yan siya ngayon sa circulation. See? So whatever fluid came out here is being restored, directed back to the circulation. Kaya wala kang edema formation. In the event that there is obstruction in the lymphatic vessel, okay? Lymphatic vessel, obstruction in the lymphatic vessel, hindi ma-drain yung lymph back to the circulation, interstitial volume increases, causing a condition called edema. And the edema here is due to lymphatic obstruction. Ang tawag natin doon ngayon ay lymphedema. Make sense? I hope so. So ano kayo mga possibilities, sir, dyan na makakause ng obstruction sa lymphatic vessel? Maraming pong factors. Number one, it could be related to infection. May mga infection po tayo that the target structure will be the lymphatic vessel. There is a communicable disease. Okay, this is common sa Pilipinas, tropical climate. There is a communicable disease that affects the lymphatic vessel. It is caused by a microfilariae, okay, that can cause lymphedema, and we call that condition as filariasis. And then remember that filariasis problem can cause yung lumalaki, okay, can cause what? Can cause lymphedema. Diba? Lumalaki yung extremity. Nagkakaroon ka ng tinatawag na parang namamaga yung area because of lymphatic obstruction. Another condition that can cause obstruction in the lymphatic vessel is what? Cancer metastasis. Now, I think I mentioned this sa mga estudyante ko sa review. Now, I hope you're familiar with breast cancer. The common site of breast cancer is the upper outer quadrant of the breast. Ibig sabihin, if this is our breast, this is the right arm, right side ko ito, opposite kasi nakaharap kayo sa akin. So this is the right arm. The common site of the breast cancer is the upper outer quadrant of the breast. And we know for the fact may mga lymph nodes tayo dito. Remember the tale of Spence? Pag yung pasyente po natin ay may breast cancer and the cancer metastasized, remember, one common site or venue na makapag-spread ang cancer cell is via your lymphatic vessel, lymph nodes. Okay? So ibig sabihin, when the cancer cells metastasize, they will get inside the lymph nodes causing obstruction. Kung na-obstruct nila ang lymph nodes, okay, kasi nag-metastasize, nag-spread yung cancer cell, it may cause lymphedema sa arm. Kaya isa sa mga indikasyon niyan na malalaman ng doktor ay yung breast cancer niya nag-spread na doon sa lymph node. Paano mo nalaman, Doc? Kasi may lymphedema na yung patient. Can you follow? So that is one indicator. Okay, but again, it is not 100% absolute. Okay, other tests can be done to your patient, but again, that can be an indicator that cancer cells had indeed metastasized to the lymphatic area. Okay, now I mentioned the lymph node. Okay, part siya ng lymphatic, part siya ng tinatawag nating defense. Kaya nga kung may mga microorganism ka, mamamaga pa yung ating lymph nodes. An inflammation of the lymph nodes is what we call lymphadenitis. Sa Tagalog, ang tawag natin dyan ay kulani. Kulani. O, di ba? Namamaga, may kulani. So, is it advisable to massage the lymph nodes na namamaga? No. We discourage you to massage the lymph nodes. Why? Pag namamaga yung lymph nodes, it contains the microorganism inside. So, can you imagine, namamaga siya, inside you have a lot of microorganisms. And here you are, naalala ko pa dati, may practice pa, pag minasahe mo doon yung lymph nodes, dapat yung unang laway mo in the morning ang ilalagay. Kaloka! So sabi nila, yung laway in the morning, yun ang gagamitin mong pag massage sa lymph node, hindi po tama yun. Okay, it's not right. So why? The moment you massage the lymph node, the moment you press the lymph node, there is a risk that you spread the microorganism na dapat sana na-contain siya kasi namamaga. Inflammation helps a lot to contain, okay, to contain the microorganism. But here you are, you press it, you allow the microorganism to spread. So again, it's not advisable. Okay? So part ang lymphatic system sa tinatawag nating immune defenses. Okay, I hope that is clear. So, yun naman gusto kong dapat i-emphasize sa mga tinatawag nating organs or structures under your immune system. Again, there are a lot of organs or structures involved. Kasi nga sabi natin, di ba, immune system is a complex network of cells, tissues, organs, and substances produced, okay, in order to protect the body from infections or other diseases. So the main function of your immune system is actually to protect you. So ito yung focus ng ating topic, protection, defenses of your immune system. Hold on. Anyway, may mga tanong ba kayo mga kapatid? Bilib ako sa inyo, anong oras na? Gising kayo ha? Hello to Lala Maagad. Thanks for watching. Okay. So what are the different immune defenses? Sabi ni Lala Maagad, hi sir. Hello din. Kumusta ka? Magandang umaga. Kung nasan ka ngayon. O, diba? Immune defenses. So actually, there are two immune defenses. Nakategorize siya into two. So what are these two immune defenses? A and B. A is what we call your non-specific. And B is your specific defense. Other book, may mga ibang pangalan to. When you say non-specific defense, okay, non-specific defense, you call this as your innate immunity. Okay, innate immunity. When you say specific defense, you call this as your adaptive immunity. Diba? Nagsulat talaga ako, ano? Now, yung non-specific defense, ano ba pinagkaiba niya sa specific defense? Or when you say non-specific, it will protect you. Okay, non-specific regardless of the microorganism, regardless of the assault, regardless of the infection, it will protect you. Okay? Protect you. Non-specific. Hopefully, that non-specific defense will be successful. Kasi pag hindi niya kayang protektahan yung katawan mo, okay, the microorganism survived, then you have your specific defense will kick in. Okay? So we call it specific because meron kang panlaban specific to that microorganism. Kaya nga specific defense. Usually, ang specific defense requires activation. Okay? Kailangan ma-activate in order for the specific defense to kick in. Kaya nga sabi ko, dapat sa non-specific defense pa lang, successful na siya. Kasi pag hindi siya naging successful, buhay pa rin yung mikrobyo, meron ka pang another defense-specific defense. Aray, no? Meron kang first line, okay? Meron kang another defense specific. What if, Sir John, hindi kinaya ng specific defense ang microorganism? Wala ka ng defense na iba, wala na. So you're considered to be an immunocompromised person. Diba? So tingnan natin na, yung non-specific defense or your innate immunity, this is present inside us, okay? Circulating inside the body, almost doesn't require activation, okay? Non-specifically will protect you regardless of the name, regardless of the type of allergen, regardless of the type of microorganism, regardless of the type of assault. That's your non-specific. Your non-specific defense, okay, na-divide siya into two. May dalawa siyang subdivisions, di ba? May subdivision pala, ano? May tinatawag tayong first line defense, Okay? First line defense. At may tinatawag tayong second line defense. Oh, ito yung tinatawag na first at saka second line defense. Yes. Okay? So ano yung mga example ng mga first line, second line defense? Ano naman yung specific or adaptive immunity? Guess what? Your adaptive immunity, this is your third line defense. Oh. Okay? Now let's talk about innate immunity or first line defense. Example here is your skin. Di ba? Taray skin, di ba? Our skin is our first line defense. The skin will protect you for whatever microorganism that surrounds you. Okay? The skin will protect you regardless of the name of microorganism. That's your skin. First line defense. Ngayon, if there's a break in the skin, that could be a good site for bacteria, for microorganism to get inside. Can you follow? Okay, so magiging prone ka na ngayon for infection. Okay? Another thing, kaya yung sinabi ko sa pasyenteng may burn injury, remember the second burn injury is characterized by blister formation. You know, a blister, there's a fluid inside. Okay? Kaya nga, we discourage you popping the blister. Because when you pop the blister, there will be a break in the skin, putting the patient at risk of infection. Okay? So kaya nga, if a patient sustained burn injury or a break in the skin, that will put the patient at risk of infection because there's a break in the first line of defense. So your skin is not selective. Ibig sabihin, hindi niya pipiliin, ikaw, streptococcus, papasukin kita ha. Friend tayo. Ikaw, staphylococcus, hindi kita friend, hindi kita papasukin. Hindi selective ang skin. Your skin will protect you regardless of the name of the microorganism. Kaya nga, non-specific. Okay? So another example of first-line defense, okay, apart from your skin, you have your mucous membrane. Mucous membrane. Okay, when you say mucous membrane, it's the lining of your gut. Am I right? Okay, may mga mucous membrane tayo dyan, just like here in the oral cavity. That is where if there is a break in the mucous membrane, what will happen? That will increase the risk of infection. If there's a break in the mucous membrane of your nose, okay, in your airway, that will increase the risk of infection. Kaya nga isa sa mga dapat tandaan natin, if your patient is receiving O2 supplement, especially if your patient is receiving a high flow oxygen, make it sure that the patient will also have a humidifier on. Because it's not okay to give 100% oxygen to your patient not humidified. Because if it's 100% air and not humidified, by the way, when you say, what is humidified? What is humidified? Humidified means to say moistened. It has to be moist. Because if it's a dry air, 100% air, it can cause drying of the airway passages. An airway passage that is so dry can cause a break in the mucous membrane. So that will give you pain. There's a break in the membrane, and that will also increase the risk of infection because of the break in the mucous membrane. Okay, so any break in the membrane, a break in the skin will increase the risk of infection. Another example for first-line defense, okay, your tears. Do you know that when you cry, it washes your eyes. When you cry, it washes your eyes. Not only that, tears contains an enzyme, okay, called lysozyme. Okay, it contains an enzyme that will, of course, kill microorganism. Not only that, kaya nga pala, laking tulong pala pag umiiyak ka. Kaya nga pag nakipag-break sa yung boyfriend mo, ayan. Pag nakipag-break sa yung girlfriend mo, pasalamat ka. Grabe sinaktan ka na, nagpasalamat ka pa. Bakit ka magpapasalamat? Maraming salamat Bakit? Malinis yung mata ko sa kakaiyak. Can you follow? So when you cry, it will wash and clean and clear your eyes. So malaking tulong yun. Okay? Now, not only that, your saliva. Alam niyo ba yung saliva niyo, may enzyme din, lysozyme, still a lysozyme. Ibig sabihin, hindi ko sinabi na it will protect you against infection na kailangan kung may sugat ka, you're gonna lick your wound. No. Ano ka, aso? Di ba yung aso pag may mga sugat sila, they lick on it, right? But we're not dogs. Anyway, so your saliva contains an enzyme, a lysozyme that will protect you. So meron siyang protection, saliva. And may sasabihin sana ako pero wag na lang kasi parang censored siya. Anyway, saliva, huwag kalimutan yan. What else? Another first line of defense will be what? Vomiting. Do you know when you vomit, it's a form of defense. It's one way of protecting you, di ba? Especially if you ingested something that is contaminated. Oh my God, nangyayari sa akin. If you ingested or if you swallowed something that is contaminated water, contaminated food, okay, or any toxin, okay, pag maswallow mo at hindi ka aya-aya sa ating sikmura, you vomit. So pag nagva-vomit ka, pasalamat ka kung nagva-vomit ka because it's one way of the body to protect you na hindi ma-absorb ng katawan. So you vomit. Kaya lang, syempre, sabi natin, anything that is too much is not bad. Anything that is too less is also not good. So if you vomit a lot, it can also cause fluids and electrolyte imbalances. Now, what do you think will be the acid-base imbalance when you vomit a lot? It can cause metabolic alkalosis. Anyway, just a heads up for your examination. So if you vomit a lot, okay, it can cause metabolic alkalosis, just like for patient having hyperemesis gravidarum, no, sa mga first trimester. Anyway, so malaking tulong para pag nagva-vomit ka. So pag nagva-vomit yung pasyente, pabayaan niyo muna mag-vomit. No? Gaya ng diarrhea. Isulat na natin dito, diarrhea. Diba, diarrhea. So pag nagda-diarrhea ka, defense din yun. So whatever microorganisms you have in the intestine, okay, any unwanted food in the intestine, contaminated food in the intestine, microorganisms, if you have a lot of bacteria there, magdadiarrhea ka para may palabas mo. Diba? It protects your body na hindi mo ma-absorb yung toxins, okay, na naproproduce ng mga microorganism or the microorganism itself. Kaya nga, pag nagdiarrhea ka, pag nag-vomiting ka, allow the patient to have that moment. Moment talaga. Moment mo yan na suka ka ng suka, I support you, girl. Suka ka lang, okay? I support you na may diarrhea. Ibig sabihin, pag may diarrhea, pabayaan niyo muna para may palabas ng katawan. Okay? Hindi ka pag nag-diarrhea, bigay ka agad ng gamot. Why? Because it's a form of defense. Diba? Instead of getting rid of whatever unwanted food you have inside your gut, you suppress it. Okay? So maganda pala na pag nag-vomit ka, just allow the patient to vomit. That's one way of protecting the body. Just be careful of aspiration. Kaya nga, one of the nursing responsibility here is, of course, prevent aspiration. Prevent fluids and electrolyte imbalances. Okay? And sabi ko nga, anything that is too much is not good. Same with your diarrhea. Kung kanina sa vomiting, you end up having metabolic alkalosis for vomiting, ano naman sa diarrhea? For diarrhea, you will end up having metabolic acidosis. Okay? Metabolic acidosis. Ang taray, ano? Anyway, sino to? Oh, meron pa dito. Hello to one Gaia MK. Hello. So yun. So these are what we call first line defense. Can you imagine that, di ba? Hindi naman pinipili ng diarrhea, hindi naman pinipili ng saliva, hindi pinipili ng vomiting kung anong microorganism ang ipalabas niya. Kaya innate, non-specific. Aray. So regardless of the assault, regardless of the microorganism, todas sila. Okay? What else? Hindi pa tayo tapos. Hydrochloric acid. Di ba? In the stomach, your hydrochloric acid. Your hydrochloric acid is a potent acid. Do you know that? It's a potent acid that will also kill microorganisms. Okay? It will kill microorganisms. So it's a form of first-line defense. Na ngayon, what if, Sir John, hindi naging successful ang first-line defense? Then you have your second-line defense. Okay, para kang in the event that the Miss Universe failed to do her job, it is the responsibility of the first runner-up. Parang ganon. Ibig sabihin, bumaba na yung nag-step down na-dethrone si na-decrown, na-dethrone si Miss Universe. Dito papasok ang first runner-up. So dito ngayon, wala na yung first line defense. Here comes your second line defense. So ano yung may example ng second line defense natin? Again, then remember, these are under non-specific or innate immunity. Marami po example ng second line defense, but I will just mention the most important things for your examination. Ano yun, Sir John? You have your inflammation. Inflammation. Diba? So, pag sinabi kong inflammation, pamamaga, this is your second line defense, which is part of your non-specific. Okay? Now, yung pamamaga or inflammation, divide siya into two. It could be a form of a local inflammation or it could be a form of your systemic inflammation. So let's identify. Minsan lumalabas ito sa NCLEX, particularly sa Select All That Apply. Okay? So what are the different signs and symptoms? Tara, nag-discuss ng signs and symptoms sa Ricafort. What are the different signs and symptoms of local, okay, local inflammation? Local inflammation. Okay, so if there is a local inflammation, patient will have redness. May pamamaga sa side. Di ba napansin nyo? Pag may pamamaga, namumula yung surrounding area. Redness is a sign of inflammation. What else? Okay? If you try to touch the skin of the patient on the inflamed area, it's warm to touch. Warm to touch. What else? Because of inflammation that will irritate the nearby and the surrounding nerves, it can cause pain. So there is pain. Okay, what else? Pag may pamamaga, what else? Syempre, there is tumor or there is swelling. Okay? Lahat sila related to vasodilation. Do you know that? Okay, because of vasodilation, when the blood vessels dilate, it increases its permeability. So blood will congest in the area because of dilation, giving you redness. Because of pooling of blood in the area, if you try to feel the part, it's warm to touch. Because of pooling of fluid inside, it can cause swelling, it can irritate the nerves, giving you pain. Most probably, ang tinuro sa atin ng mga CIs ninyo or CIs natin dati, rubor, dolor, calor. Alala niyo yun? And of course, the last part there, panglimang sintomas ng local inflammation ay loss of function. Or you call this as functionalasa. Okay? Bakit siya nawawalan ng function? Because of pain, because of what they call swelling. Okay, especially if the area is near the joint or in the joint area. A joint is a combination, or not combination, it's a connection of two bones. So if the area na namamaga ay near the joint or above the joint, that definitely can cause loss of function. You try to immobilize the area because there is swelling and there is pain. So these are what we call signs of local inflammation. So if there's such thing as local inflammation, we also have signs of systemic inflammation. So if the inflammation is systemic in nature, if the inflammation is systemic, ano yung mga sintomas niya? Present pa rin po yung local inflammation. So you will still have signs and symptoms of local inflammation. Present pa rin sila yung 5, pero may nadagdag na 2. Making it systemic inflammation. So when will you know that the inflammation is systemic? First, signs and symptoms of local inflammation are there. Second, there will be an elevation in your what? ESR. What is ESR? An erythrocyte sedimentation rate. So don't forget this. An elevated ESR would mean that there is systemic inflammation. Not only elevated ESR, wag kalimutan, there will also be fever. Oh, fever is also a response of the body, an immune response. Fever is also an indication of systemic inflammation. Okay? So, ang tanong, bakit ba kailangan may fever? Ano ba yung relevance ng fever? Sige nga. Paano ba nakakatulong yung fever? Hindi kayo, di ba? Ang sagwa kayo ng feeling na may fever. Di ba? Pag may lagnat ka, ang sama sa pakiramdam, di ba? I don't like the feeling of having fever. And the last time nag-fever ako, when was that? The last time I had fever, tama na alala ko, nag-fever ako, nagkasakit ako nung umuwi ako ng Pilipinas last year. Paglapag na palapag ko ng airport, iba na yung pakiramdam ko. Parang 3 days after ako dumating sa Pilipinas, last year, nag-fever ako. Tapos inubo ako. Sabi ng aunt ko, normal yan. Kasi yung mga aunt ko na dito sa US, pag umuwi sa Pilipinas, nag-fever din, nagre-respiratory infection. So yun, umuwi ako ganun din. So sabi ko sa sarili ko dati, pag umuwi sa Pilipinas, iniisip ko, ang arte naman ito, umuwi lang ng Pilipinas. Pag hindi kayo sanay sa klima sa Pilipinas, kasi nagkakasakit kayo. Ang aarte ninyo, di ba? Ngayon, na ako umuwi, you cannot help it. No? Ganun talaga. Ang ginawa ko pa dati, bago kumain ng Pilipinas, uminom na ako, naglaklak ako ng vitamin C. Akala ko okay na yun. Pero you know what? What's good thing about it is that, sabi ko, my immune system is intact. My immune system is kicking in. Hindi ganun kagrabe yung aking lagnat. Samantala yung friend ko na umuwi, may friend ako umuwi din ng December. Umuwi ako ng October sa Pilipinas last year. So umuwi siya ng December. So nakabalik na ako dito sa US. Siya naman pauwi ng Pilipinas ng December. Matindi yung pagkasakit niya doon. Mas matindi. Sabi ko nga sa kanya, uminom ka ng maraming vitamin C, hydrate yourself, kasi expect mo maninibago ka sa Pilipinas, change in the climate, change in the weather, change in the environment. There's a higher risk na magkakasakit ka. Yun, nagkasakit siya. Parang 3 weeks yata siya nagkasakit. Parang buong stay niya sa Pilipinas nagkasakit siya. Samantala ako naman, parang 1 week lang ako nagkasakit. Yun, pero nag-fever ako. Diba? Ang tanong ko, hindi ko nasagot, ano yung relevance ng fever? Paano nakakatulong yung fever? Why is fever essential? Why is fever important? Para saan na ba yung fever? Do you know that your fever, malaking tulong yun? There are 2 effects of fever. First, your fever will expedite, will accelerate, pabibilisin niya ang healing process. That's number 1. Second effect of your fever is that your fever will help you boost your WBCs. Okay? Your immune responses. So mapapabilis niya ang paggaling mo. Can you follow? So those are effects of fever. So pag may fever ka, pabayaan mo lang. Namdamin. Okay? Seize the moment that you have fever. Because again, that is a form of response to infection. But take note, hindi lahat na may fever, may infection. Kasi pwede ka mag-fever not related to infection. Pwede ka magka-fever related to what? Tissue injury. Okay, remember, fever is related to pyrogens na na-release ng WBC pag may infection. Okay, pero sabi ko nga, pwede ka magka-fever kahit na walang infection. Okay, I hope that is clear. So again, these are actually part of what we call non-specific or innate immunity. So may tinatawag tayong first-line defense at saka second-line defense. So what if, Sir John, hindi pa rin kinaya ng second-line defense? So dito na papasok yung specific or adaptive immunity. That this requires activation, sabi ko nga. So under specific or adaptive immunity, may dalawa din siyang examples. Okay, ano yun, sir? Matinatawag ng humoral response. Okay, matinatawag din tayong cell-mediated response. Other book, it's cellular-mediated. Other book, cell-mediated. Pareho lang yun. Cellular-mediated or cell-mediated. Okay. Remember, when I started, I mentioned the lymphocytes, the B lymphocytes, and the T lymphocytes. Dito papasok yun. Okay? The humoral response, okay, the cell that mediates humoral response, majority of the cell here, okay, are the B lymphocytes. Samantala, ang cell-mediated response, okay, it is actually mediated by T lymphocytes. Okay, see? So alam mo na, may specific siya. Ano ba yung para sa ano ba yung mga B lymphocytes natin? It's common during what? During bacterial infection. T lymphocytes, common saan yan? Common siya during viral infection, graft versus host reaction. So ibig sabihin may specific ka na defense. So ibig sabihin, kung may bacterial infection ka o may panlaban ka sa bacteria. Kung may viral infection ka o may panlaban ka sa viral infection. Can you follow? Kung may mga bagong pinasok sa'yo na bagong organ na hindi mo naman organ o may panlaban din, kaya ma-recognize ng katawan. O this is a non-self tissue. So i-reject ng katawan. Ganun yun. So, ibig sabihin may specific defense tayo. So, these are the different defenses that you need to understand. So, you have your non-specific defense, you call it your innate immunity, and then another is your specific defense or your adaptive immunity. This is also called your third line defense. So, they will come in order. Para yan, no? Ganda nila. Okay? So, ibig sabihin, pag naubos na yan lahat, hindi kayang protektahan, then, ibig sabihin that your immunity, your immune system is not functioning well. There is a problem. Okay? There is an incompetent immune function. Okay? So, you're an immunocompromised individual. Okay? And part of that, you need to remember are the different types of immunity. Okay? So may tinatawag, I need to clear my whiteboard now. May tinatawag po tayo mga kapatid na active immunity at may tinatawag din po tayong passive immunity. So ano pinagkaiba ng active immunity sa passive immunity? So when we say active immunity, it is a type of immunity that activates immune response to produce antibodies. Ibig sabihin, ang active immunity is a type of immunity na kung saan i-activate niya yung immune system mo to produce antibodies. Active, activate. Passive immunity is a type of immunity na kung saan it will not activate your immune system to produce antibodies because what's given to you is already an antibody. Can you follow? Okay? So, technique mo, passive, pasa. Ang ipinasa, antibody. Okay? Much more na-divide siya into two, whether it's a form of artificial or it's a form of natural. Okay? To sum it up, so active immunity is a type of immunity that activates immune response to produce antibodies. Pag sinabi ko ng passive immunity is a type of immunity that what? Gives antibodies. Okay, it will not activate. Okay, let me give you an example. Let's say let's put this in a table. So you have your active and then you have your passive. Aray ng ating background bed. So here is your natural. Here is your artificial. Okay? So let's say, active, ibig sabihin na activate yung immune system mo and the immune system will produce antibodies in natural form. So here, example is getting sick. Okay? So in short, illness. That's a natural activity, right? It's a natural phenomenon, getting sick. We get sick sometime. So if getting sick, if you got sick, what will happen? Nagkasakit ka, natural yon. Active because when you got sick, it stimulates your immune system to produce antibodies. That's active, natural. Pag sinabi ko namang active, artificial, it did not occur naturally, pero it stimulated your immune system to produce antibodies. Example here, your vaccine, your toxoid. Okay? Now, let me give you an example. Let's say this is a person who will receive an immunization. Okay? Let's say this person will receive a vaccine called BCG. Your BCG, oh, by the way, alam niyo ba na walang BCG vaccine dito sa US? We don't have BCG vaccine. BCG vaccine is not part of their expanded plan for immunization. Okay? Wala po. Kasi nga hindi naman uso dito sa Amerika ang tuberculosis. So BCG stands for Bacillus calmette-guerin. So what's given to the person is an attenuated microorganism. You see, attenuated, weakened, synthetically prepared, laboratory prepared, weakened, cannot cause infection but can trigger immune response. So ibig sabihin, ang binigay sa kanya ay Bacillus calmette-guerin. Okay? So it's a microorganism. So when microorganism enters the body, when this BCG enters the body, kay malalaman ng immune system yan. So the immune system now is stimulated And once stimulated, the immune system will produce immunoglobulins, will produce antibodies. Ibig sabihin, pagpasok ng vaccine, the vaccine enters the body, okay, the immune system was able to stimulate that, was able to sense that, and it stimulated the immune system to produce antibodies. So it activated immune response to produce antibodies. Kaya lang, hindi siya natural na nangyari. Binigay sa iyo na bakuna. Kaya artificial active. Can you follow? Okay, what about toxoid? Example ng toxoid. Ayan. So for example, bibigyan kita ng TT. Ano ba yung T? Oh my God. Ano ba yung TT? Iba yung nasa isip nyo, ha? Iba yan. Iba yung mga nasa isip ninyo. Ayoko ng mga ganyang iniisip. Palakpakan ko na lang kayo. Okay? Ano ba yung TT? Tetanus toxoid. Okay? So ibig sabihin, yung binigay sa'yo dito, for example, toxoid. Okay? So for example, binigyan ka ng Clostridium tetani. Yung Clostridium tetani, it will produce a toxin. Your toxin. Yung toxin na yan, na-produce ng Clostridium tetani na microorganism, it will stimulate the immune system to produce antibodies or immunoglobulin. So again, na-activate niya ang immune system. So it's active immunity. Binigay sa'yo, hindi naman siya natural nangyari. So it's an artificial active immunity. I hope that's clear. Tandaan lang, pag active immunity, it activated the immune system to produce antibodies. Eh ano naman yung passive natural? So pag sinabi kong passive, it will not stimulate the immune system to produce antibodies because what's given to you is already an antibody. Give me an example of a natural passive, breastfeeding. Diba? Sabi ko kanina, breastfeeding, your colostrum, is rich in immunoglobulin what? Immunoglobulin A. Ibig sabihin, mama, taray, no? May dalawang O, breast. Ayan. This is the baby. Oh, suso. So, mom now, ang mama, may breast milk. And this breast milk contains a lot of immunoglobulin A. Okay? Immunoglobulin A is an antibody. Am I right? It's an immunoglobulin. Ang ibinigay niya sa baby is already an antibody. So pag pumasok ba ang breast milk sa katawan ng bata, is-stimulate niya ba yung immune system to produce antibodies out of that? No. Because what's given to the baby is already an antibody. So ipinasan niya ang protection sa bata. Ipinasan niya ang immunoglobulin sa bata. What's given to the child is an antibody A, or your immunoglobulin A. Okay? So it will not stimulate the immune system. What's given to you is already the gamot. What's given to you is already an antibody. Okay, what about artificial passive? Example here will be your HTIG. Are you familiar with this? Human tetano-immunoglobulin. Okay, binibigay natin yan as an IM, intramuscular. Artificial passive. Example, you have your anti-rabies. Okay, anti-rabies. Anti-venom. At mga anti-anti, artificial yan. So, ibig sabihin, ito yung gamot panlaban sa rabies. Am I right? So, if you were given an anti-rabies, what type of immunity is that? Anti-rabies is already an antibody. So it's a passive because what's given to you is already the gamot, but artificially prepared. So it's an artificial passive immunity. Okay, I hope this one is clear. Okay? So again, there are two common types of immunity. You have your passive immunity and then you have your active immunity. I hope this one is clear, guys. So I hope maliwanag na ngayon yung mga tinatawag nating defenses. You have your non-specific defense subdivided into the first and the second line defense. You have also your second type, which is your specific defense called your adaptive immunity. This is your third line defense. Okay? And apart from that, nabanggit din natin yung mga immunity natin na active or immunity, passive immunity, and we also categorize that into two, whether it is a form of artificial or natural immunity. I hope that is clear, guys. If you have any questions, let me know. Okay? Now, last, paano ba natin ma-boost yung ating immunity? Of course, number one, adequate rest. Importante yan. You drink a lot of water, you hydrate yourself. The second. Third is what? Okay, third, of course, eat vegetables. Okay, of course, mga lalo na high in vitamin C, high in zinc, okay, yun po sila ang magbo-boost ng ating tinatawag na immune system. Okay, so adequate rest, hydrate yourself, okay, rich in vitamin C, rich in zinc will boost your immune system. Okay? Clear? So kailangan pa bang uminom ng mga vitamins kung kumakain ka naman ng gulay? You know what? I would suggest kung kumakain ka na ng gulay, you don't have to take supplements. Do you know that? If you're eating vegetables daily basis, you don't have to take supplements. Pero pag hindi ka naman kumakain gaya ko, okay? Okay lang magsalita, okay lang magbigay ng advice, pero in reality, hindi ko naman ginagawa. Oh my God, that's bad of you, Rica Fort. I know. Okay, so, umiinom ako ng mga supplements. May mga inom ako ng mga vitamin supplement. Yun, importante yun. Kasi nga, I'm working night shift. So anyway, I think that's all, guys. Thank you so much. If you reached this far, maraming salamat po. And I hope you learned something. Okay? And watch out for my next Sunday stream where we talk about normal physiologic changes during pregnancy. Okay? And anong oras na ba? Oh my God. 3:27 na ng madaling araw. 30 minutes na lang, mag-alas 4 na. Ayoko na matulog. Mamaya na ako matulog. Kasi nga duty ako mamayang gabi. So, parang din ako nag-duty na night shift. Anyway, thank you so much, everybody. God bless po. And then stay healthy. And I'll see you next Sunday. Bye, everyone.